Hello everyone, this is Dr. Hema Divakar. One of the main things in ectopic pregnancy is it will be good for us to diagnose it before it ruptures, because once it ruptures, there is a lot of bleeding, the complications are more. So always as doctors, our aim will be to suspect ectopic pregnancy when you miss your periods, when the beta HCGs are high, when we do the scan but we are not seeing the pregnancy in the uterus. We always have a very high degree of suspicion of ectopic pregnancy and start acting upon it even before the rupture or the bursting and the bleeding happens. But unfortunately, if it is already ruptured, one of the best ways to get in there is by a keyhole surgery or the laparoscopic methodology, whereas the incision on your skin is small. There is a telescope put in there, and with the other laparoscopic instruments, we reach the spot of the bleeding. We clear out all the clots that are already existing there. We suck out the ectopic pregnancy and we clip the tube or stitch the tube or cauterize the tube, do something to stop the bleeding. And when you have a cut in your hand, you will give a pressure. When you have a injury to the scalp, they will put the stitches to stop the bleeding. So the bleeding control from the source of the bleeding is a must. And in ectopic pregnancy, it may be on the tube, it may be on the ovary, it may be just lying around the uterus but not inside of the uterus. We have to approach and quickly seal the area which is bleeding. Make sure that there is no other issue in and around the uterus. Have what we call the hemostasis or the bleeding under total control. Stabilize you, and the discharge process is well within 24 hours after the laparoscopic surgery, because once you get at the root of the problem, though the problem is life-threatening and it's considered dangerous, but the timely action will save lives. The worst is over because the diagnosis has been made. The laparoscopic approach, which is the advanced or the latest approach to ruptured ectopic pregnancy, has sealed the bleeding spot. And from the surgery, your recovery is well within 24 hours. But how long you should rest, how long it will take to recoup, entirely depends on the amount of blood loss which has happened because of the ruptured ectopic pregnancy. Here we are talking about ruptured ectopic pregnancy. Therefore, as I mentioned earlier, it's always our endeavor to diagnose and act upon the ectopic pregnancy before the burst of the blood vessels happen and you lose blood. So if you're already anemic, say your hemoglobin was just about 9 grams percent and you've had the ruptured ectopic pregnancy and hemoglobin has gone down to 7 gram percent. So the recovery phase will be a little slow because you have to replenish the blood back. You have to get your general health level back to the normal range of the hemoglobin of 10 or 11 gram percent, which will take a little bit time. Sometimes there are situations where we give blood transfusions if the blood loss has been too much, or injections of iron to help you recoup early. If there's no infection, if there's no anemia, if the rupture has been there but not so much of blood loss, then your recovery is double quick. Within weeks' time, you can resume all normal activities. So essentially, it's not the laparoscopic surgery from which you have to recover. It is the after effects and implications of the blood loss due to ruptured ectopic, which sometimes delays the recovery period, is what I would like to say. But if you're feeling energetic enough, if your hemoglobin is normal, laparoscopic surgeries are very, very easy to heal, and you can spring back into your normal action within a week after the ectopic pregnancy surgery.